Hey, it's Jennifer Polyp, and I've been meaning to make this video for a while, but I had a really cool learning seminar that I went to. It was hosted by the Center for Neuroskills. They are based in Texas, but they have other locations, like I know in California. And they were talking about brain injury and how that affects daily living and things that can actually help with it. So before we get into that, I want to remind you, if you haven't subscribed, I would love for you to join the Polyp family on YouTube. So please make sure that you are. So if you guys remember, if you've been following, I, a few years ago, fell and hit my head. And I actually did that 10 years ago also. And both times I ended up with a brain injury. The first time we didn't realize really that's what I had, because we didn't connect the signs, the symptoms, until 6-7 years later, actually, when I was diagnosed with abdominal migraine. And we came to the conclusion that that started when I fell and hit my head the first time. Well, the second time I fell and hit my head, it was apparent within a few hours that I had a concussion, and it led into post-concussion syndrome. It has been over a year or two maybe by now, and so I've been left with migraine, and it's a constant migraine. I take preventative migraine medication to help keep it in check, but life has really changed for me, and it is much easier now than what it was. But I experienced a lot of emotion dysregulation. It was as if I had lost all my coping skills. I still have trouble with with executive function sometimes. Memory is an issue. Even my speech, I have a hard time sometimes thinking of the word I want. Like I can't think of the word. It used to be that I could only think of the definition. Now I can find a similar enough synonym, but I say things backwards sometimes. I make up words. I do word salad sometimes. It's not just the normal with age that we forget things here and there type of thing. It's more than that. And so I learned a lot at this seminar, and I wanted to share that all with you, because brain injuries can be a lot of different things, right? They can be strokes, they can be falls, anything that happens to the brain is a brain injury. And from what the Center for Neuroskills has learned through their research and their programs is that it doesn't matter when it happened, you can receive rehab for it and see improvements. And I really liked not only their breakdown of what was happening with a brain injury, why it leads to these different issues, but also their model for treatment for brain injury. Now, yes, some brain injuries are going to be permanent, but what they've seen is that through treatment, you can see improvements. You may not be able to return to work, but there will be improvements. And the ultimate goal that they have in their rehab is getting people back to work, getting them back to their daily living, their lives that were before the brain injury. So I'm going to share with you what they shared with me. And they talked to you about, with any type of brain injury, what happens is that our physical functioning, our psychosocial interactions, visual, perpetual skills, our cognitive abilities, memory processing, speed and problem solving, multitasking, those are all things that get affected by a brain injury. And so what happens is that wherever the injury is, that part of the brain is not communicating the way that it should to the rest of the brain. And there can be multiple areas within the brain that are damaged. And what happens is, so we have a neuron, and it has an axon. They called it like a noodle, because it's like a tell. And so if you have the communication of these neurons in your brain, what they do is like it's here, and it's a chain of command type of thing. Well, with brain injury, there's going to be neurons that are damaged. And so that communication gets messed up. And with neuroplasticity, meaning that it can grow these axons to reach different neurons, but that takes time, and it takes a lot of repetition, using the brain to be able to rebuild those connections, to have that plasticity to rebuild. So what happens is, if it's supposed to connect here and communicate to here, but this axon is damaged, or this died, is no longer connecting to the next one, it has to grow either a new one if it can, or a different neuron is going to have to grow to be able to connect, to communicate to back into that line of communication. And when these things are happening, what we'll see, according to the Center for Neuroskills, is that you may see symptoms in either your hormones, so your neuroendocrine function, your sleep, or your gut, your microbiota organisms, the microorganisms in your gut. You'll have gut dysbiosis. And if you have one, they're going to connect, and it's going to affect the other two. And so there's a lot of disruption that happens, a lot of different symptoms that can happen from a brain injury. So what is their model? And what is the model that I'm wanting to start practicing? I've done some in the past, and I want to add more onto it. So they really recommend a holistic approach of physical therapy, occupational therapy, speech therapy, and mental health counseling. Because like I mentioned, there's a lot of times, and it's understandable, not only you're trying to process and navigate something that's happened to you, but your brain is not functioning, it's not communicating the way that it was supposed to before it became injured. And so there's a lot of dysregulation of emotions. So that helps also with being learned to process, to learn coping skills again, and also helping with the brain to heal itself. Physical therapy helps with, not only just muscle strength, but safety, increased blood flow, and decreased inflammation. That can be very important for healing as well. Occupational therapy can help with kind of treating those cognitive deficits that interfere with daily functioning. And occupational therapy is a really interesting, really great therapy that I don't think gets highlighted as much as physical therapy. I've used it for tendonitis in my wrists and my elbow. And yes, that has nothing to do with brain injury for me. But it's things that I wouldn't necessarily think about. And it's kind of, the way I look at it was that it was learning how to do things. And it was not needing physical strengthening for, but it was learning how to do things in a different way, perhaps, so that would allow for. But you combine that with the brain injury, and because you're learning things in a different way, it also can help with those cognitive deficits. And then speech therapy is not just about speech. It involves cognitive training, so that can help with executive function, with brain processing, with cognitive processing, all those different functions going on there. I think a lot of us, or at least I know I do, when I think of speech therapy, I mainly either think about learning how to speak, or with difficulty swallowing and doing improving that. I didn't ever think about really speech therapy as far as cognitive functioning and improving that. And that's what I'm wanting to actually add on, because I have done physical therapy, not necessarily for my brain injury, but I have done physical therapy at least once, if not twice, since my last fall. I've done occupational therapy. Again, that wasn't for my brain injury, but I did receive that for 2.5 months or so, but after my fall at some point. But I haven't done speech therapy, and I've never done speech therapy. I would like to see what that can do for me. I've done counseling. I'm in counseling still. That was very helpful, working through all these things. Now, I do know that sometimes, I know at least with home health agencies, which I'm not needing home health, I'm able to leave my home. I'm not sure if this is the same way for outpatient, though, is that speech therapy cannot be done by itself. And so they would need to do physical or occupational therapy also. I'm not sure what the guidelines are for that in outpatient settings. I'm going to find out, because my plan is to ask for speech therapy, and If they need me to add on another therapy, I will. I'm hoping I can just do the speech therapy unless it really would be beneficial with my fall to add on one of the other ones. Physical therapy is always beneficial, I think, at least for me, because I can always use some exercise and with guidance so that I'm not messing it up. I'm always needing to re-strengthen my core again, which helps protect from hernias, and it helps with managing, eliminating chronic back pain from my abdominal surgeries. So I know I could definitely benefit from physical therapy. I actually do better with exercise if it's under physical therapy versus on my own or even a personal trainer. But these are some of the things that I learned from the Center for Neuroskills, and this was not a sponsored video or anything. It's just something that I found really interesting, very helpful information that I wish I had had before I fell. I think it would have changed the trajectory of my recovery from a brain injury had I had this information before. It was not any information that was shared with me by any of the providers that I had. I don't think this is necessarily a wide, well-known model for brain injury rehab, but I think it should be. It absolutely sounded incredible. They started their program, their center, and I'm trying to retell the story. It's been a little bit, but so the founder, their brother, had some type of brain injury, and it had been like 20 years before, and so the center they opened up, they were doing research and things like that, and really kind of with a goal of helping their brother and people like them. And they found that even 20 years after that brain injury, they implemented this model for their brother, and their brother showed signs of improvement with their functioning mentally, physically, cognitively, all those different things. And so it sounded incredible to me. It's something I'm looking into more. I know at least in my state, there are other similar programs. Again, I did not know about this. Nobody talked about any of it when I had my falls. And so I have some places that I'm looking at locally. One of the nice things with the Center for Neuroskills is that during this presentation, they shared that if they accepted a patient into their program and they were out of state, they would come get the person and take them back to the rehab center for free. There wouldn't be an additional cost or anything for that, which I thought was really an amazing service that they're doing for individuals. They did really neat things that were even helpful for different patients. For example, as part of a therapy, someone they had trouble getting into this vehicle. Not a real vehicle, but it's like a simulator type of thing that they could work on relearning skills with this. So they had another patient build a stool. So you may have with certain jobs or skills that someone has, they give them real life experience to help practice and relearn how to do those things and how to do them safely too. And that's also beneficial for other patients and how they were able to really think out of the box, really give hands-on things that is real life experience for individuals in their programs. So it was just really cool. They even had, like, if someone was electrical job of some type, they made like these components for the person to practice on to help relearn those skills, relearn how to do those things, because it's not just about physical ability, right? It's not just like a strength or dexterity thing. It's also the brain communicating to the rest of the body to operate in a certain fashion, whether that's we're speaking or we're doing. And so there's a lot that goes into what a brain injury can affect, and a lot of different things that can actually help with it. So I hope that you found this helpful. I'm still in awe by this information. And yeah, if you've had a brain injury, I'd love to hear your experience, what's helped you, what you might be looking at later down the road to try to help with it. And I'll give updates on my journey, my experiences with speech therapy. So I'm going to ask for it. That doesn't mean that they'll give it to me, but I'm going to ask for it, and I will update on what comes from it. I do a lot of updates, mainly on Facebook, though. So you may want to check out there over there also. But I will continue giving information and updates and things here too. So if you guys have any ideas or suggestions of things that you would like to learn about, please let me know down below.